Hi, my name is Jamie Schumacher and I am the host of Altru Unscripted. Today with me I have Mark Waind, and we are going to talk about the implementation of technology in healthcare. Well, welcome Mark. Thank you for being with us today. Can you tell us a little bit about how long you've been at Altru and what your current role is?
Sure. I've been with the health system for just over 36 years, and my current role is Executive Vice President and Chief Information Officer.
36 years, that's quite a bit of time. I'm sure a lot has changed in those years.
Lots of changes in technology for sure over 36 years, but you know, time seems to fly so fast that it's been just a really fun journey.
What do we currently provide our customers in terms of technology that makes it easier for them to access the care they need?
Well, we currently use an electronic medical record system called Epic, and Epic has functionality called MyChart that extends to the patients. MyChart allows that patient to look at any of their patient records, schedule their own visits, message to their providers, refill prescriptions, and many other features.
Oh, for sure. I mean, I appreciate how I can message my provider or how I can reach out and get my lab results and the information that I need. So I understand that Altru recently received a couple of pretty neat recognitions for the implementation of technology in healthcare. So correct me if I'm wrong, but I think at the end of last year it was the 2021 Chimes Digital Health Most Wired Awards in Acute and Ambulatory Care. And then this year we received our recertification of the HIMSS Stage 7 status for both inpatient and outpatient awards.
That's correct.
First of all, congratulations. That's quite an honor. What do these awards tell us about the care that Altru provides its patients?
Well, these awards really tell us that we are putting better tools in the hands of our providers, which will lead to better care for our patients. Let me give you a little background on these organizations. Chime and HIMSS are both considered to be leading experts in healthcare information technology. And they do these awards each year, and they raise the bar each year. So there's higher expectations and requirements each year that you apply for the recognition. So in the end, it really does lead us to have a better system in place that provides those better tools for our providers and leads to the better care for the patients.
That's really quite impressive. Moving on to kind of the topic of telemedicine or virtual health. We hear those terms thrown around quite a bit. Can you explain for us what these two terms mean, and are they interchangeable?
Well, virtual health really includes telemedicine. Virtual health will include telemedicine, our video visits, our e-visits, our remote patient monitoring, and even phone calls if it's a way for us to have a patient encounter. Telemedicine we've had in place since probably 2008, and we've used it primarily in the past to do those specialty kind of visits to rural areas. These are all visits that are not face-to-face, and that's what would be categorized as a virtual visit.
Who would you say, in your opinion, most benefits from telemedicine, let's say from a video visit?
Well, I think it's kind of across the spectrum. You know, as we went through the pandemic, telemedicine, even though we had a program in place, it really expanded because we had way more nursing homes that wanted to try to protect their patients from the spread of COVID. And so they didn't want to have those providers coming into the nursing home. And so we were called on to set up a lot more of those connections to protect those patients. On the other side of it, you and I and everybody wants to have more convenient care, and so those video visits are really popular with just about everybody because it's quick and easy for you to have that visit.
So aside from the nursing home residents utilizing telemedicine during the pandemic, how do you think the pandemic changed people's perceptions about telemedicine?
Well, I think from the clinical side, it really changed it. We have always had a strong information technology program here. We had all the tools to do this, but really until the pandemic came, did we really get the push that people wanted to use those tools.
So Mark, in the 30-some years that you've been at Altru, What makes your job worth it? What makes it worth it to come into work each day and do the work that you do?
Well, that's pretty easy. I've told my wife this for years, that the team of employees that we have in information technology really motivate me. They're all so talented, and I'm familiar with a lot of the health systems and the CIOs around Upper Midwest, and I can tell you our information technology team is hands down as good, if not better, than all of them.
That's really neat to hear. It often does come back to the people that are around us that make the biggest impact.
For sure.
Well, thank you, Mark, for joining us and talking to us today about technology and healthcare at Altru. And thank you to all of you for joining us too. Please follow us more on Altru Unscripted on our social media channels. Stay safe and be healthy.